Diseases in the circulatory system. Atherosclerosis. Atherosclerosis is the collection of fats, cholesterol, and other substances in the arterial walls. This collection of substances restricts blood flow. It is a specific type of disease called arteriosclerosis, which is when the arteries get thick and stiff, which also restricts the blood flow. Arteriosclerosis affects normal blood flow to the organs. The buildup in the arteries leaves less room for blood flow through the arteries, which allows less blood to move through the arteries to the organs in the body. Normally, arteries bring oxygenated blood from the heart to the body, and then veins would bring the deoxygenated blood back to the heart, and the process would repeat over and over. Although people with arteriosclerosis still have this normal process, it is just restricted. The blood does not flow at the same rate as people with normal arteries. The system is modified because blood flow is restricted. Unlike a normal artery, the inside of the arteries that have the arteriosclerosis are lined with substances like fat and cholesterol. This buildup makes the blood flow through the arteries slow down. In time, this decreased blood flow can lead to a number of health problems. Arteriosclerosis is diagnosed by looking at a patient's medical history, a physical examination given by a doctor, a coronary angiogram, Doppler sonography, blood pressure comparison, MUGA or radionuclide angiography, and a thallium myocardial perfusion scan. A coronary angiogram takes a picture of the arteries and allows the doctor to see inside and possibly see a buildup of substances. A Doppler sonography is an ultrasound that shows the blood flow through the arteries. It reads the sound waves that red blood cells to show images of the blood vessels. A blood pressure comparison compares blood pressure from areas in the ankles and arms to see if the blood pressure is different throughout different places of the body. MUGA or radionuclide angiography uses a small amount of radioactive substance to view blood flow in the arteries. A thallium myocardial perfusion scan looks at the blood flow in the heart using a small amount of radioactive substance. The short-term effects are the most immediate one is a decrease in blood flow. Depending on what artery in the body is blocked will determine in the long-term side effects. When arteriosclerosis is found in the arteries near the heart, it can lead to coronary disease, which leads to chest pain and can ultimately cause a heart attack or heart failure. Arteriosclerosis seen near the brain causes carotid artery disease, which can lead to transient ischemic attack or a stroke. If arteriosclerosis is in the arms or legs, it causes peripheral artery disease. Peripheral artery disease is when the body cannot circulate blood properly and makes the person more susceptible to burns or frostbite. Chronic kidney disease is something that happens when arteriosclerosis is present near the kidneys. It affects kidney function and prohibits the kidney from making waste exit the body like normal. Lastly, if arteriosclerosis is present anywhere in the body, the person is susceptible to aneurysm. An aneurysm is a bulge in the artery wall. If the aneurysm bursts, then it could be life-threatening. Arteriosclerosis can be treated by living a healthier lifestyle with a better diet and exercising, and in more serious cases, medication and surgical procedures might be necessary. Medications can be helpful because they combat the symptoms and the patient might even start to recover. In the very serious cases, the patient will need surgery to reverse the effects. The goal for the surgeries is to clear the artery, whether the arteries get a catheter inserted into them to help the flow, or the surgeons go into the arteries directly and remove the fat and cholesterol buildup.